But in the meantime, I noticed that it's 4 o'clock now. I want to thank the team for organising this webinar. We have a great set of speakers, and our chair is Alastair, so I will now turn over to Alastair.
Thank you very much indeed, Marcia. So welcome everybody. Thank you very much for joining the meeting. This is our 8th and final session of the ethical issues arising in public health emergencies. So this is the last webinar of the series. And we are joined here today by what I can only describe as an internationally renowned panel of experts. And I'd like to say a huge thank you to everybody who's joined us. This particular webinar it examines a number of ethical issues that have arisen in the context of the COVID-19 pandemic. And there are a series of questions, but what I'd like to do is firstly just explain who we have. We have Professor Haihong Zhang from Beijing Medical University in China. Give it a good wave. Thank you very much. We have Professor Youngmo Koo, who's the Associate Professor of Biomedical Ethics in Seoul in South Korea. And I'm going east to west, you understand here. We then have Professor Ames Dai in Johannesburg, who is a member of the UNESCO International Bioethics Committee. Then in the UK, we have Susan Tansey, Dr. Susan Tansey, who's a Boyd's consultant, a member of the Nuffield Council of Bioethics, which is very unusual for somebody who's worked in the pharmaceutical industry, so that's great. And then farther out to the west, we have Professor Fernando Lola Stepka, who's the Director of Interdisciplinary Center for the Study of Bioethics in the program of Global Bioethics at the Institution of International Studies at the University of Chile. So we have an awesome group of individuals, and I'm sorry, it's not me, so I'm going to try and ask them some subtle little questions for everybody and get their views. And if you wish to make contributions, questions online, please feel free to ask. So as most of you will be aware, COVID-19 started in the east of the world. So I'm going to start off with the question to Professor Haihong, which is, you know, what are the top ethical issues for your country? And I will then come to each of the individual speakers in turn. So please, Haihong.
Thank you, Professor. And good day, ladies and gentlemen. Here is Haihong Zhang from China Peking University. I'm an IRB professional working in Peking University. So today for my report, I will mainly focus on research ethics and a little bit on research integrity during the COVID-19 pandemic in China. So firstly, you know that since the early identification of COVID-19 cases in China, scientific research has played an important role as for containing such kind of pandemic. So there's something very positive that worth noting is it is widely accepted as a consensus that such kind of human subject research should be approved by ethical review committees. So this is something very positive from our experience during the COVID-19 pandemic. I would like to bring and share with everybody here. However, we do have several challenges that I think may be very common either in China or worldwide. Firstly, and the very general one was how can we handle or conduct such kind of ethical review with guaranteed quality and high efficiency. For the concerns of the ethical review quality, you know, because of the nature of the research conducted during the pandemic, it would be very complex, and we do not have so much kind of previous experiences for learning. Also, in such kind of context of carrying such kind of research and conducting such kind of ethical review, so it would be very challenging for ethical review committees. In China, during the past 10 years, we set up our ethical review system basically based on each individual institution. So the capacity building from each individual institution is varied a lot. these variations also make such kind of review quality more complicated. A lesser issue regarding to the ethical review efficiency is about how can we have such kind of clear review working procedures. We developed such kind of policies and procedures during the normal time. However, most of the ethical review committees in China before the COVID-19 pandemic, we do not have any specific guidelines or working procedures on how to handling such kind of emergency ethical review. So this is kind of very general quality and efficiency issues that regarding our ethical review here. Also, a lot of new challenges were raised during our ethical review, like the use of big data and some new ethical issues or concerns raised about the secondary use of data. We can see that during such kind of pandemic time, people hope we can as quickly as possible to identify some kind of new information and knowledge, and also transfer those new knowledge into clinical practice as quickly as possible too. So in such kind of context, the urgent list and also the blurring between the research and the clinical practice makes it much harder for ethical or IRB review professionals to handle such kind of things. So another issue besides the quality and efficiency is about the infrastructure for ethical reviews, including necessary personnel or and electronic systems for how can we just conduct all the IRB review work remotely and so on. So even in such kind of period, we call it post-pandemic time in China, we are still facing such kind of paradigm changing in how to conducting efficient ethical review in normal times and in emergency times, such as COVID-19. So the second part for my short presentation, I will just shift a little bit and maybe give a quick flavor about research integrity. So as we mentioned, we would like to share some experience, both positive and some kind of concern here. So from the research integrity perspective, something very positive here in China, we have waitlisted that more and more transparency. I think we have waitlist more transparency about conducting research. The concrete number of registration of clinical trials is certain kind of very good evidence. And at the same time, there's a lot of high quality papers published in China in Chinese Mandarin. A lot of scholars discussed ethical issues and tried to providing ethical guidelines to help investigators handle such kind of ethical issues, like detailed interpretation of ethical review standards and ethical concerns about data sharing or such kind of things. So such kind of high quality Chinese publications locally help our local research community a lot to have better understandings of ethics and research integrity. Also from the administrative perspective, government agencies and different institutions are working together to update such kind of administration process, like encouraging the report, in-time report of research outcome. So such kind of things are very positively from our side, and we can witness such kind of progress in have such kind of more open and transparency in conducting research and research integrity. However, as we mentioned before, we still having certain kind of challenges, like people raised about concerns about the data quality or some specific cases about paper retraction and so on, which I do believe all these cases were happened everywhere. So to sum up, there are a lot of work to do, and it's really nice and great honor to have this opportunity to be here to share experiences, to surface the problem for further discussion. And with that, I will close my report here, and thank you for your attention.
Thank you very much indeed. That was very helpful, and we will almost certainly come back to you with further questions in a moment. So for most of you, you will be aware, Beijing is 7 hours ahead of us. We're in our time, but we have an even later person. So Professor Youngmo Koo, you're, I think, 8 hours ahead of us, if I'm correct, which is rather late at night for participating in this webinar. So thank you very much. And can I hand over to you and hear your thoughts on ethical issues for your country?
All right. Thank you, Alastair. Good morning, everybody. Here is it's midnight, just past the midnight in South Korea. Anyway, I wonder, Elena. I wonder if Elena could post the PDF file I sent. PDF file of the paper I sent this afternoon for the
I already have actually, yes. Thank you so much for that. Yes, everyone's received it.
Great.
That was very helpful.
Yeah, if you post the fifth page of the paper, that will help participants understand the general situation of South Korea regarding COVID-19 pandemic. All right, let me just start. I live in Seoul, South Korea, teaching medical students medical ethics. My background is philosophy. I also serve the IRB, the Institutional Review Board, in several medical agencies in Seoul metropolitan area. The Korea is, as some of you know, the small country with 50 million population, and the country itself is about the same size as the UK, but however, it's divided south and north. So the size of the country itself is half of UK, again, with 50 million population. In terms of COVID-19, ever since the outbreak in January this year, Korea has done a good job in managing the pandemic, remaining quite low. The death toll so far is no more than 350 patients, and recently the recent report shows the daily report of the confirmation of patients with COVID-19 is under 200 daily report. So so we feel we've been doing a really good job so far, but the situation is uncertain, as everybody agrees. So we better be cautious day by day. But during the 6 months period of the tragedy, an outstanding issue emerges of the tension, constant tension between individual and state. That is, on the one hand, individuals' constitutional right, right to freedom of assembly and association. On the other hand, legitimacy of states' right to limit citizens' liberty in the name of public health emergencies, i.e. COVID-19 pandemic. So in this tension, I see three instances between the individuals and government in terms of their right. The first, I would say, is can state be legitimately enforced to its citizens to wear facial masks in everyday life, private or public. Of course, there are most of citizens are willing to comply with the government instructions and guidelines to wear facial masks to avoid or to minimize the potential harm to others and themselves. But however, there are still see people who are reluctant to wear the facial masks, even with the potential harm to others, in the name of individuals' right. The situation, I mean, we see those instances often and often, more often, as what the general public are getting tired or weary of the situation. The second instance, I would say, is there are some people who strongly claims to go to church instead of having their services online on Sunday. So they would insist gathering to hold services every Sunday. Yeah, even though their behavior could enhance the potential harm to others in terms of public health safety. And the third one, not the least, can state legitimately to order the business owners to close their business or to limit their business time in the name of public health safety. Actually, those the orders have been made, and the government order have, of course, the public support. But the problem is there are business owners left to lose money. So they are forced to lose money and their business opportunities, and they left very poor, and they complain. So the next question is, should government pay their losses or to subsidize in the name of maybe solidarity? So that poses another serious question the Korean society in general faces in terms of COVID-19 pandemic. Okay, that concludes my short presentation. Thank you.
Thank you very much. Well, so let's get a bit closer from a timing point of view to the UK and go to South Africa, to Professor Ames in Johannesburg, and hand over to you.
Hello, well, I should say good morning, good afternoon, and good evening, and maybe even good night to some of the participants. I just want to thank the organizers for inviting me to participate in, I think, this very important session of yours. I'm going to talk on corruption and pandemic plundering, which is really something that's devastating most of us in my part of the world, and that is South Africa. But before I do this, I just like to paint a picture of what happens during a pandemic and why it's so easy to actually plunder during the pandemic. Difficult choices have to be made during pandemics. And we know that COVID-19 has affected a substantial proportion of not only country-level populations, but the global population. And we've seen significant social, economic, and personal disruptions and hardships arising. I do believe that this may last for some time, with sustained pressure on essential services like health, food supplies, and even production of our drugs and distribution of our drugs. So I don't think this is peculiar to South Africa, but this is generally. Now, when we look at resource distribution principles, historically in our interpandemic years, they usually focused on giving priority to individuals at most risk of serious negative health consequences. However, when we manage a pandemic, principles guiding preserving the function of society must of necessity be drawn upon as well. And when there's pandemic plundering and looting by our rogue public health officials, one wonders what happens to these principles. It's important to include diverse voices, including those of citizens in general, during the course of planning management in a pandemic. And special attention has to be paid to vulnerable communities. Cultural, ethnic, religious, and other values also have to be considered. And importantly, transparent procedures for decision-making is essential. Mutual trust and social solidarity are vital during these challenging times of ours. And when planning for pandemics, I think going forward into the future, and even during the pandemic, planning the management of the pandemic, it's important to be mindful of these values. Both institutions and individuals who are entrusted with governance over scarce resources have to make choices. Sometimes these are difficult choices in terms of their allocation, and there may be collateral damage that may result. But when the choices made are that of personal profiteering, then the collateral damage that results is truly unconscionable. It's important that our institutions and our individuals at government structures are guided by the notion of stewardship, which encompasses trust, ethical, and good decision-making. Trust is indispensable in the relationships at the different levels of healthcare decision-making and delivery. And our leaders need to be reminded of that. When access to care is denied and there is suffering, this is a betrayal of trust, especially if it's due to pandemic looting. And it's an abandonment of the country's populations at a time of their greatest need. It's so important for decision makers to realize that they have to be trustworthy. They need to ensure early engagement with stakeholders, and decision-making processes must be ethical and transparent. And for this integrity, which reflects the need to act with honesty, reliability, and fairness, and a willingness to be held accountable to explain one's actions, is critical. However, sadly, evidence from pandemics, present and past, reveals otherwise. And our lived experiences during COVID-19 is that the pandemic itself has given rise to unethical process with little to no openness and very significant risks of corruption. So why do I say that? Massive resources are mobilized to respond to health and economic crises. Together with this, there is a suspension of many prevention and enforcement mechanisms. We've seen that, including oversight over procurement. Social distancing has created a fertile ground for opportunities for corruption or for the rapid perpetuation of these immoral activities in already existing corrupt regimes like the country that I come from. So the pandemic response in many cases is compromised by corruption. It's compromised because trust in public institutions is undermined, supplies and resources are squandered, and access to care impeded for those in need. I just also want to say corruption is not only a South African problem. It remains a global problem, according to the World Justice Project, and it persists in almost every part of the world despite robust global attempts over the past 20 years to address the situation. Fraudulent charities, government and private sector benefit fraud, identity theft, government contract and procurement fraud. We felt this now in South Africa during COVID-19, but it had plagued the United States during Hurricane Katrina, Rita, and Wilma. In West Africa during the Ebola crisis, funds and supplies were diverted and containment measures were compromised as citizens themselves bribed their way around restrictions on their movements as a result of corrupt practice. And we've seen some type of corrupt practices like this among some of our very own citizens here in this country. We've also seen during COVID-19 price gouging and lucrative contracts being awarded without proper procurement processes in South Africa. But if we look at it globally, you also find other countries involved like Colombia and Italy. In addition, funds aimed at addressing the economic crisis that has resulted as a consequence of the pandemic and social distancing have also fallen prey to corruption. And we've seen evidence of fraud in the distribution of unemployment benefits. And a report from the US Department of Labor this year as well actually reported on something like this also. Trading off accountability for speedily procuring supplies needed during pandemics is morally offensive, and transparency during the processes is necessary so perpetrators can be held accountable without foregoing timelines in terms of procurement. Procurement of personal protective equipment, amongst others, has been a huge problem in my country, with alleged perpetrators at the level of the office of our country's president and the head of health in the province that I live in. The head of health in my province has been suspended because of this. And currently there is a widespread investigation into these allegations. But I just want to end off by saying that when healthcare workers, other frontline workers, and members of the public lose their lives because of selfish greed, as rogue public officials exploit the weaknesses in the systems, yes, created by the pandemic itself, I think this should be considered a crime against humanity. Thank you.
Thank you very much indeed, Ames. Thank you very much. Susan, your chance. Well, we're back in the UK, so please feel free.
Okay. Hello, everybody. So, there are so many ethical issues, as we've heard, come up in relation to COVID-19. As Alastair was saying, I became a council member of the Nuffield Council of Bioethics just as the pandemic was taking off, actually, at the beginning of March, so which is a very interesting time to become a member. What I've tried to do is arrange my thoughts about some of the ethical issues to talk about by looking at sort of categories and considering, I think, some of the ethical issues that come up have related to communication or lack of communication, and I think that is very important. I think some relate to collaboration, and we've seen some excellent collaboration, I think, during the pandemic, but I think that is definitely something that we can build on. And I think there have been a lot of unanticipated consequences or collateral damages, as Ames was just saying, and I think we have to learn from that and not make the same mistakes again. I'm also reflecting on the previous webinars that the faculty has hosted, and I'll start off by talking about ethical research in times of the pandemic. And I think both for therapeutics and vaccines, it is extremely important that we balance both expediency but also maintaining ethical vigour, because it's just so important not to exploit vulnerable populations, to make sure that the research that is done on the one hand is done quickly because we want to get the therapeutics and the vaccines to our population, but also without risking safety issues or making it not a robust research. And in fact, the Nuffield Council published a report just as the pandemic was starting on ethical research in public health emergencies, and there's an ethical compass that is described in that report, which I think is very helpful to refer to when we're looking at many of these ethical issues, and that talks about equal respect, about helping reduce suffering and fairness. And I think that also comes into the ethical issues that I'll talk about regarding access to therapeutics and vaccines. So I think what we've seen in researching therapeutics is, in some cases, it was possible to speed things up by looking at repurposing medicines that are already out there, but for different indications. In some ways, that was good because we could move straight into later phase studies. But in other cases, well, some of the other consequences that we could argue were unanticipated, but perhaps we should have anticipated, were that by publishing research at an early stage on sometimes not very robust research at that point in time, so case series, we saw the fact that these medicines were available, so they started to be used frequently for the indication of coronavirus infection, and this led to some difficulties for patients getting access to treatments for arthritis, etc. And I think that is something we really need to think about very carefully in future. I think it brings into the ethics of, on the one hand, getting everything published and open access, but on the other hand, of still having some careful thought about what is published and when, because it can have these unintended consequences. I think one of the other aspects is that obviously there's a lot of focus on research in COVID-19, but I think, as we heard in one of the webinars that we held talking about rare diseases and paediatrics particularly, and also in cancer patients, that the trials in those patients were, in some cases, you know, approvals may have been delayed, or patients were actually had to come out of the study in some situations because there had to be a balance made of, you know, the safety when the patients were not able to visit hospitals, or perhaps the resource was being used on coronavirus infections. And I don't really have the right answer there, but I think we need to think about that. And I also think this problem we've seen, particularly in the UK, and I'm sure it's there, you know, sort of worldwide, is that patients themselves have not been coming to hospitals for treatment for serious conditions in many cases. And I know the Royal College of Paediatrics in the UK has particularly spoken about that in the case of children. There have been deaths where children haven't been brought into hospital because there's a fear of them getting coronavirus infection. So I think some of those are very, you know, real problems that we really need to address better if we are to get a second wave, or you know, a similar pandemic in the future. I think access to therapeutics and vaccines, we really need to address that. It is beginning to be addressed to make sure that we don't just have a vaccine available for the UK or for, you know, our own country or region, that it's also going to be available for lower and middle income countries that, you know, maybe in even more need, because of course to socially distance in some of the countries like Brazil or India is much more difficult than it is for us here in the UK. And the COVAX alliance, I think, is hopefully beginning to address that. But again, I think we need to get better at that. And I think another issue that I just want to mention before I finish, that I think is particular ethical issue, is the testing. And I'd be interested to hear experiences in the other countries of the other panelists. But in the UK, there has recently become testing of asymptomatic people, particularly in areas where there has been sort of an increase in infections. And you know, I think that a test that started off as diagnosing coronavirus, in fact, COVID-19 infection, is now being used in patients with no symptoms. And I haven't been for a test myself, but I imagine that the people going for these tests are not providing what I would call an informed consent, which you would normally expect when somebody's you know, having a screening. They will not understand the concept of false negatives and false positives. It's looked at as very much black and white. So if somebody gets a negative test, potentially they could be taking more risks than they may be otherwise. And also in many cases where this testing is being carried out, areas of lower income, where the actual advice that they're given to then isolate for 14 days if they have a positive test, there's a lot of consequences for them. You know, they may lose their job and certainly would potentially have 2 weeks without any pay coming in. So that's an aspect I'd be very interested to hear experiences of the other panelists. So I think I've certainly not covered all the ethical issues, but hopefully I've just given an overview of some of the things I think are important.
Thank you very much, Susan. So, Fernando, we've been holding back from you. We're now going to Santiago. So, please, the floor is yours.
Thank you very much. I am very happy to participate, particularly being the last one, because I can spare myself of many comments that previously presenters already did. I am a professor of psychiatry at the University of Chile and was formerly the director of the bioethics program of the Pan American Health Organization, which is the regional office of the World Health Organization for the Americas. And for some time, I also was part of the International Bioethics Committee of UNESCO. I will restrict my observations to 3 points. The first one is a characterization of the current situation, because it is not only a viral pandemic, it is also a global disruption of social life and economic life. So it is a pandemic in terms of geographical regions, but it's also a syndemic in terms of the affectation of all aspects of life. And that is the reason why we have problems in the economic sphere, in the social sphere, in the relations between government and citizens, So it is not simply a problem of a virus attacking a population. It is a problem of global impact. Second, the principle of one size fits all is inappropriate. We have different populations. We are all moral strangers. We don't share the same beliefs, the same customs, the same philosophical positions. So these 2 points are essential for us because ethical reasoning should serve to priority setting in the first place, to an inclusive decision making, that is, all people must participate in the way decisions are taken, and also it must be culture fair. That's my first point. This is a global affectation of all aspects of life, and I call that syndemic, using the term proposed by an anthropologist, Merrill Singer, many years ago. Now, my second point is that we need to address 3 different issues. The first one is, how do we reflect upon ethical issues since we have so different challenges? How do we approach the problems, the health care problems, the social problems, and the economic problems? It is not evident that everybody will think that the viral infection is the most important thing in their lives. For some people with hunger, with poverty, go out and have to deal with the daily sustenance and bread is more important than that. So it's a very simplistic notion that the only problem from ethical we have is. So we have 3 ways of approaching this. First, what kind of reasoning are we applying? We can apply what Max Weber called ethics of convictions, the Gesinnungsethik, as they used to say, the Germans, or we apply an ethics of responsibility, dealing with the consequences of actions. And that is very different if we think of healthcare and we think of economic disruption. The second point, and that was made already by one of our presenters, is the tension, the clash between the individual interests and the group interests. Of course, governments, authorities must think first in global interest before individual welfare. And what we are witnessing now in the second phase of this syndemic is that the mental health problem that will come upon us is very important, and will be probably more important than the viral infection in the next couple of months or years. That's the second point. And the third point is that every society has a set of experiences behind. It is not the same to live in China or to live in Manhattan or to live in Bolivia. This is what the German historian Koselleck called Erfahrungsraum, the space of experiences, and that's a very determinant thing, how to think ahead. And the other most important thing is that aside from this field of experiences, all societies, all people have some way of expecting something. That is what he called Erwartungshorizont, the horizon of expectations. And that's very determinant point to make when we are dealing with ethical issues. So we have these 3 ways of approaching the problem. First, thinking on duties, on convictions, and thinking on consequences, on responsibilities. Second, the tension in every society between the individual and the group, or the individual and the state, or whatever you want to call. And the third, the experience every society has contrasted with the expectation every society has, because it is not the same. Now, which are for me the main challenges ahead? First of all, we have to deal with so many different aspects that it's a very simplistic view to think that this is a healthcare problem. It is not a healthcare problem. It is Perhaps the disruption started with the healthcare problem, but it's now a global problem with economic. Just witness what happens in many parts of the world. People are reacting against their loss of privacy. They are reacting against measures taken by authorities. They are reacting against the trust they should have in authorities, in science, in medicine. When I was reading about the Black Death in the 14th century Europe, we observed that many very respected institutions, like the Catholic Church at that time, lost their reputation because of the way they reacted to the crisis. What we will see in the next couple of years is that the authorities, the political, the scientific, the technical, will lose some of the reputation they have enjoyed up to now. And I say there is no public health without public trust. And trust will be the main loss we will experience during the next couple of years. Loss of trust in government, in authority, in science, in medicine. And that is also an ethical challenge for us to deal with. The other problem is integrity. We have seen that corruption might be important in many parts of the world. That's true. But integrity also on the part of the scientific establishment. What are we communicating to the public? How is scientific research being translated into useful information for the public? Because no measure taken by any authority will be followed by the population if the population doesn't feel that it is a fair decision. That's the reason why I say that priority setting is the main essential ethical challenge in the future. And why do I say this? Because it's not the same to prioritize contagion, the threat of contagion. We have also to prioritize how people survive under conditions of economic disaster, like it happens in many places. How do we deal with structural inequalities in many societies, which now come to light? They existed before, but this crisis brings them into light. This is not new, but this is a way. How do we see now that how deficient several social systems were before this? So the challenges ahead will be, first, to select if we are going to operate on the basis of custom, belief, or social use. That's the ontological point of view, according to some religious or humanistic principles, or are we going to deal only with the consequences of the decisions now taken? How are we going to prioritize thinking in individuals, in their personal lives, or in the collectives? We know that totalitarian regimes are always better than democratic ones to deal with emergencies. That is not a new fact, because they impose on people certain restrictions and that's it. How are we going to deal with this tension between individual and group in the future? And the third point is the experience each society has to be conceptualized, has to be in some ways summarized, and someone has to, that's is a problem for government, for thinkers, for people, because we have to have a proactive ethical position. We cannot expect that everything will come out as smoothly as it has been. We have to take ethical decisions before the problems arise. And why is that? Because we have to reconstruct trust in science, trust in societies, trust in governments. The sociologist Durkheim used to say that solidarity had two main aspects. One is what he called horizontal solidarity between peers, and the other is the vertical solidarity between people and their authorities and their leaders. That's what I wanted to share with you. My 3 points: the characterization of the current situation, not as simply a viral infection, as a global problem that is syndemic. Second, the 3 main axes: the tension between the individual and the group, the tension between beliefs or values and the consequences, and the tension between experience and expectation, and finally, the challenges ahead, the trust in institution, the tension between liberty and safety. Thank you very much.
Thank you very much, Fernando. That was very helpful. So I've got a couple of questions. We've got lots of questions coming in. Lots of people have got comments and thoughts and what have you. But I'll just throw out two questions for you at opposite extremes, if you like. One is, do we need to adjust or change our approach to ethics during a public health emergency? Secondly, at the opposite end of the spectrum, how does the international community best overcome obstacles to ethical practice when national societies, party political preoccupations and so on present data? So what are people's views? How should we address this? Anybody got any particular thoughts? Fernando, you're clear on some of these areas. So at an international level, how do we best overcome nationalistic, party political, all those sorts of issues? How do we address that more globally?
Well, first of all, I already said we have to recognize the fact that we are all morally strangers. Although we use the same words, we don't believe what those words mean. And we're also epistemic strangers. Although we can use the same words, we are not understanding the same thing under those words. So under this situation, anything about ethical reflection should consider that one-size-fits-all solution is not appropriate. And I would suggest 3 axes for ethical decision-making in the future. First, we should consider what is proper, what is good, and what is fair. Proper, good, and fair. Just, I would say, proper, good, and just. Decisions taken should be proper in terms of scientific validity. They should be appropriate. They should be good in the sense that moral justification must go along with technical grounding of the decisions. And third, they must be just, not only in terms of distributive justice. We are thinking, of course, how are we going to distribute the vaccines, how equity should prevail in all our decisions. I also talk about contributive justice. That means people should be allowed to contribute their ideas, their feelings, because otherwise populations will not follow the directives emanated from authorities. That's my position in this issue.
Hi Hong, can I? Sorry, somebody else wanted to contribute. No, Hi Hong. Just building on that a little bit. If I think about China, how do we get big data? Because there are studies that are done with very small numbers of patients, and can you talk through what does big data look like? How do we use big data to justify what we do?
Yeah, it's kind of really great question. And just at the very beginning of our, I think, many clinical research, so we initiated such kind of clinical research in timely. However, during the research period, we just identify a lot of research will be short for human subjects then required to finish this study or have certain kind of valid data. So it kind of very challenging problems when such kind of investigator came back to ethical review committee for consultation. So the ethical review committee just give their suggestions that if they under the I think judgment from the principal investigators. The investigators have to justify whether they should go on the study or not. If they could not find enough patients to go on their study, maybe suspension or termination of their study would be proposed from the ethical review part. However, the ethical review committee are still thinking about how about those human subjects has been enrolled or still in the intervention process. So different investigators would be recommended to coming together and discussing possible solutions. So kind of very challenging problem for us. Yeah.
Okay. Yeah. Young Mo, what do you think from a Korean point of view? Does this have a bigger impact globally, or what's your thinking on terms of the ethical practice?
Well, it's a tough question to answer. I see the situation is getting even worse as the pandemic gets worsened. This global pandemic makes the rich people even richer, and the poor people getting even poorer, because the people who can make advantage out of this opportunity, so the gap is getting wider and wider. So in this under this situation, the humanitarian appeal what makes its voice really hard to be heard. So when we talk about ethics, I'm sure there are many people who are likely to be skeptical toward this type of approach. I myself am not a skeptic at all, but the situation is very tough. So we have to be very realistic to cope with this situation, to make any realistic contribution at all. So
thank you very much.
I stop here.
So thank you very much. So I could go in all sorts of different directions here. The reality is we've got 2 minutes left of this before we move to our garden party and so on. So before we do that, I just want to say a huge thank you to everybody who's participated, not just today, but during the last 8 meetings that we've had going back 16 weeks. We've had a series of amazing presentations and interaction and so on. But fundamentally, the key for me, the key elements of this have been not just the presenters, but the faculty have done an amazing job in preparing everything and getting things set together. My committee of ethics and practice have done an amazing, there are a series of individuals who've done an absolutely amazing job in preparing for this and in consultation with all sorts of individuals. It's been just fantastic, and I really, really appreciate everything that's been done. And please come back to us, talk to us, contribute to the faculty, have an opportunity to participate. I'm sure we will do many more webinars of this sort. But you know, I would like to say a really, really huge thank you to everybody who's participated in multiple of the events, and it's been an absolute privilege to be part of this. So thank you very much. So thank you very much for everybody who's participated in this, and we will now move to the next stage. So thank you very much, and we will have the opportunity for people to participate as much as you need with questions and so on. Thank you very much. Thank you.
Thank you.
Marcia, do you want to comment?
Yes. I just want to thank everybody for their participation. So this part we call the tea garden or the garden party or the rose garden, and feel free to pose your question. Yeah, wherever you like to call it. So please pose your question. And I'd like us to revisit the questions that Susan posed in her presentations, because I don't think we touched on those. And do you want to rephrase your questions again, Susan? Because I thought they were very good.
I think I was going to come to that
well
next,
in
but
this session.
Time ran out.
Yeah. No, go ahead, Alastair.
No, go for it, Susan.
Okay, so were you meaning the testing, Marcia, or
Yes.
No, it's a particular I don't know, bugbear of my own, I think, that I really worry about the testing. And I'm not by no means an expert in testing, but I mean, I think it's it comes under the compass of industry. And I think, yes, obviously there's the part about discussing the standard of tests and how good they are, but I think at the end of the day there are no tests that are 100% accurate, as far as I know. So there's always going to be this problem of your false positives and false negatives, and obviously at the beginning of the pandemic the tests were being done primarily in hospital patients that had symptoms of coronavirus, and in fact were most of them very sick. And then now it's been sort of moved into testing outside, and of course this is very important for care workers, so I'm not necessarily saying no testing to be done outside the hospitals, but I think when it comes down to testing asymptomatic people, which is what is happening, and particularly in areas where there appears to be sort of increased circulation of COVID-19, this sort of testing and then expecting people to isolate. And I mean, it's been discussed that you don't even know what date to isolate from, because you haven't got normally it would be 14 days from your symptoms. 7 days I think it was initially in the UK. So I'm very interested to hear what's going on in your own countries, the other panelists. So I'll shut up now. Yeah.
Well, Fernando, can we ask what's your thoughts?
Well, as I said before, we have the tension here also, as in other societies, between liberty, freedom of choice, and the impositions of authorities. And not everybody is convinced that the scientific evidence through the press or through authorized channels is reliable. And that's a very important issue, because if we don't convince people how to share the decision-making process, we will not be successful in having people comply with the regulations. And trust in institutions, trust in information is not very widespread nowadays. And as I said before, for people, the virus or that healthcare problem is the least important one. People who are struggling with hunger, with economic decisions, they don't care about being into a series of contagion possibilities or not. Why is life the most important value when bad life is not a good thing? That is a point we have heard a lot here in South America.
Hong, what do you think?
Hi, Susan. Basically, I do agree with you. However, I really would like to share some kind of phenomenon happened in China. So usually, even for myself, I participated in the test just conducted by or organized by our university. So I think in July, all the students who stayed in the campus and all the university faculty were conducted such kind of test. And we do have several cases in Beijing or other cities. Maybe at the very beginning, previously several tests, they were negative, but after another test, they become some kind of positive. So we had such kind of several cases. The person had such kind of experience will feel so bad. However, for majority of the public, they still do have the willingness to be tested. Especially in our second wave or some other cities like Beijing, once certain kind of cases were confirmed, usually the local community may be living in the same area or same building. Other residency will be required to conduct such test, but such test would be conducted for free. So majority of the public have certain kind of acceptance of the doing test. So yeah, that's from, yeah.
Marcia, do you have some questions that we should be asking? I can't hear you. You're muted. Can you hear me? We can't hear you. Oh, now we can.
Sorry. But there's a question from Natasha Anwar, and I don't know, Natasha, do you want to come on and speak more to the comment that you've made about the clinical sensitivity and specificity of the test? Are you still there?
Hi,
hi, Natasha.
Hi, thank you so much. It's been great to be part of this session today. So I'm in diagnostics, and one of the things that we kind of focus on is to actually be able to calculate and determine the clinical sensitivity and specificity of these tests. But because these tests were new, and because this virus is new, we still don't have enough data yet to actually determine the clinical sensitivity and specificity. So all we've been going on are individual sensitivities and specificities of these tests. And until and unless you correlate that with the clinical outcome of an infection in an individual, and you work on that data, it's really difficult. And that's one of the reasons I think we're seeing this sort of difference in the, you know, at one point somebody will test positive, another point somebody will test negative. But I think that's also really hugely related to additional understanding of the natural history of this infection. We still got to put the pieces together, and I think, you know, until we do that, it's really hard and difficult to really sort of. I think we've been making too many assumptions, because I think we've been sort of pushed to try and do that because of the emergency, because of the lack of data. So that was my comment. Thank you. Sorry to ramble on.
Yeah, that's really interesting to hear, and I think that, you know, I think I didn't talk too much about the communication that I mentioned when I started talking earlier, but I think this is where communication and transparency is so important, because I think if we're testing in that situation, the public and individuals who are having the test should understand that that's the situation. And also, you know, the things I've seen on social media, I can't believe, you know, and I think if it's not communicated in the right way, then somebody's going to communicate the wrong way. And there's so many sort of things about, you know, conspiracy theories and things like that, and unfortunately people take that on board. Yeah.
So Fernando, how do we prepare a paper, a document, an article that would clearly articulate what we recommend? You're muted at the moment. There we are.
Yeah, are you asking me? Well, I often during the preparation of this webinar that our journal Acta Bioetica, which now turns 20 years old. It was started while I was a staff member of the Pan American Health Organization, and it's a trilingual journal with good impact factor. It's Portuguese, Spanish, and English. So we could probably join forces and select several issues, and that could be a good way of maintaining this dialogue, which I found very interesting and very stimulating, because we see the problems from here in a quite different form as you can see that in Britain, or as it said in China. As I said to you before, the health problem is the least relevant one in this time but this in my country. The politicians are engaged in a struggle between right and left, between a plebiscite we are going to have with criticisms to the government because they haven't handled as they thought the pandemic. And as I said before, anticipatorily, the problem we have ahead is a loss of trust in all kinds of institutions. Medicine, the socio-technical system of medicine, has been unable to respond to people. The healthcare system here is in, I couldn't say in collapse, but people feel, and that's a way of expressing anxiety also, aggressively against the healthcare system. And so I think if we continue insisting that this is a viral problem, this is a social problem with priority setting very different for different walks of life and very different people. I think that the political chaos we are seeing in many parts of the world is a reflection of the anxiety, and I would think we should devote another conversation to the mental health pandemic, which has to do a lot with how people respond to the ethical challenges in the future. And the key word is proactive ethics. We should anticipate what will come. We should anticipate that the communication is not simply putting in a paper out or giving advice on television. We have to devise new ways of convincing people that what authorities are saying is important. Governance is critically damaged in these days.
Marcia, let me hand over to you. You've got a list of people, so introduce them.
Yes, so I was going to ask Hosnia, you made an interesting comment based on that last question, and I wondered if you wanted to come in and expand on that in terms of the public understanding of the pandemic.
Absolutely.
Would you like to come in?
Yes, good afternoon. Thank you very much for such an interesting and insightful dialogue. I believe the public understanding and basically knowledge on this pandemic is varying at all levels. Some people still believe in conspiracy theories, and they don't even agree that this virus exists in first place. So my question to the panel is, we are talking about transparency and ethical communication. We have some people who don't believe that exists. We have some people who are too anxious to do anything because of the virus. And we have people who don't care about it because they think that it is carrying on for so long and they have to go back to the normality of life. So it is a wide range within even one nation. It is a very wide range of understanding under the same social norm, culture, and religion belief. So I wonder how even what a transparent communication look like? What does that mean?
Very good question.
So open to the panelists.
Yes, I mean, my comment would be I completely understand what you're saying, and I think it's like I suppose in scientific, a bit like a scatter plot, isn't it? And I feel like we've got to find some way to pull people together. Now, you always, there's always going to be difference of opinions and differences, but I just think if we could get people on board understanding better and maybe more, and it comes to this sort of private versus society that Fernando was talking about, to get that sort of sense of sort of community, and so that the majority of people understand, are on board, and will have this trust. But as just been said, I think that's the big problem, and I think we have to try and work against the loss of trust before it gets worse. I think that would be my thought. Yeah.
Other comments from people? Yes, go ahead, please. Hi,
yeah, I will just have an example in China, just how the government and different institutions help to educate the public about COVID-19. So we have seen very simple and direct, straightforward flyers everywhere to tell people wash your hands, use sanitizers, wearing masks, or keep distance with others, something like that. So we do believe such kind of strategies, maybe there's no certain kind of face-to-face communication, but we do have a lot of such kind of flyers or new strategies helping the public have better understandings of the situation. So I think that's kind of very interesting example from Chinese experience.
Okay.
Thank you very much.
Yeah. So at this point, oh, does anybody else want to comment? Mind jumping in?
Oh, go for it.
Okay, so at this point, I'd like to bring in Lawrence Yamua. So I hope I've said that correctly. Lawrence, do you want to raise your question?
Yes, thank you very much. My question is mainly about data, big data, from experience over the years. When things are not able to get into the power that the statistical power that the study needs, it poses a question as to, is it worth doing the study? And my comment as well as the question is, when things have started before the pandemic and the ethics committee and the regulatory bodies are looking at what do we do in terms of the numbers to be recruited not meeting the desired numbers for power, so that when it is published, other people in other countries can take it as good enough to make it a policy, then one way I believe would be to reduce, instead of going for the study as a power-based study, could it be more exploratory, in which case the numbers will not necessarily matter, and that should allow the ethics committee people, saving all the other aspects of ICA, GCP, and FDA, for them to approve the study rather than just throwing it away because of problems in recruitment.
So who would like to comment? Go ahead, please. Ai-hong.
Thank you. Thank you, Lawrence, for this wonderful question. So from our experiences in China, most of the ESCO review committee will consider whether the sample size is appropriately designed. So basically, we have certain kind of minimum necessary requirement. So the investigators or protocol should have such kind of justification from statistic point why they need such kind of sample size. And the ESCO review committee were trying to analyze or make the judgment whether the proposed number would like to be enrolled is appropriate without any unnecessary risks to extra human subjects. So this would be one point at the very beginning for review. Another point is the ESCO review committee will consider whether the research team have certain kind of resource to conduct this study, including whether they can enroll such kind of certain number of human subjects in a short period, or whether they have such kind of resources, including financial or non-financial, and so on. So this is for the initial review. Before we approve a study to move on, we have to set certain kind of consideration for the sample size and whether the qualification or resources needed were in place. So during the implementation process, once the investigator came to our ESCO review committee and told us they had certain kind of problem to enroll enough patients. So maybe certain kind of amendment would be planned certain kind of open more research site, or trying to maybe change a little bit about their inclusion or exclusion criteria with the still having certain kind of scientific validity. So this is some kind of middle way. We have certain discretion. And finally, if the PIs or the ethical review committee have such kind of assessment, then this study could not be really completed as they first anticipated also. So maybe the suspension or termination. So that's our experience here.
Young Mo, do you have a comment or thought?
Well, could you repeat the point of the question?
So Lawrence, do you want to repeat your question again?
Yes, the question is more about the power of the study in terms of if sample size cannot be met during implementation of the recruitment stages, and instead of the ethics committee having a worry as to whether they should suspend the trial or not approving it as then what do we do? Can it be changed from power-based study into exploratory study?
Yeah, thank you, Roland, for the question. When we review the research protocol submitted to institutional review board for an approval, we follow a golden principle. If the science is bad, then the proposed the study should be unethical. So based on that rule, if he proposed the study lacks the power, and the statistician will probably point out and figure out and make a suggestion to correct the problem, to make the proposed study more scientific, which in turn ethical. So to some the statistic consideration should be crucial as part of a scientific requirement that will make the proposed study perfect. Okay, that's yeah.
Thank you.
Thank you.
That's the rule we follow.
Yeah.
May I make another comment?
Mm-hmm.
I remember quite well in 2002 when we had the SARS problem, and I was a staff member of the Pan American Health Organization. All the officers in bioethics were summoned to Brussels to discuss what kind of fast-track decision-making process could be established for the emergency. Because if we look out at the orthodox procedure, it takes weeks before we react to any emergency. At that time, some problem had been in Hong Kong in a hotel. A person had contaminated the elevator, and we couldn't just wait for the ethics committee to meet and quietly examine. So we had the fast-track decision-making process. That means that the committees all over the world should react more promptly under conditions of exception. It's like when you work in an emergency room in a hospital, you want to save life, not to restore health. That's the situation in which we are now. We have to proceed. And the other problem, which is very important, is that we will have to test those new vaccines, we talked about this, the challenge trials that were tried by the Japanese army tried this procedure at that time during the Second World War and was deemed completely unorthodox and unethical. What are we going to do now? People, we will have to ask if someone wants to volunteer for the challenge trial, that means be vaccinated and then contaminate. Those are questions that are day-to-day questions that we have to decide. And if we keep the orthodox of our usual ethical decision-making process, we are not in the right track. The problem ahead is how to be proactive, not reacting to the situation, but proactive. We should devise now good guidelines to deal with this emergency and the coming emergency, because this will not be the last.
Right. In the last 5 minutes, I want to bring in Mark Lodge for his question. So we need quick responses to this one. Mark, do you want to come in?
Yes. All right. Can you hear me?
Yeah.
Yes, we can.
Yeah.
I was just picking up on something I think everyone saw. I picked up something Fernando said about the effect of plague, if you like, on established belief systems. And I just threw in that it wasn't just the Black Death with the Catholic Church, it was also the growth of mercantilism and the spread of the printing press. And there is a danger, of course, of making historical comparisons, but now we've got COVID and whatever the next thing is, because I agree with Fernando, this is not the last thing we're going to have. We also have globalization and we have the internet. I think the point I'm making is this, that looking forward, this has been a great discussion, we've been discussing what is, but looking forward, say for the rest of this century, all our belief systems are going to be tested, and some might fall by the wayside and some will stand true. And I think that's the ethics community will be as challenged as the economic and financial community and the other political communities. And I just wanted to, it's a statement of the obvious, but I think we should be wary of being wedded to something that might actually move under our feet. And that's these are times of uncertainty. I'll just pick that up.
Thank you. Responses. Anybody? No?
Unless you think ethics are solid, sorted, and are immutable and will never change. There.
There you go. There's your challenge. Young, you want to come in on that because you're a philosopher?
Well, things change. I agree, and that is the case with the ethics. However, there is some portion of ethics we have to stick to. That is the place where we need the discussion, and we build consensus among what experts and the general public as well. As long as we like to follow a democracy, but you know the sad situation it shows us the leadership is being challenged globally. So we are living in a era of challenge in many ways.
Absolutely.
So, yeah.
Absolutely. And we're being challenged by the time now because we're coming to the end. And this has been a fantastic webinar, and it's our last one. And I just want to take this opportunity and thank everybody who's been involved. I want to thank Alastair because this is his second one he's chaired, but also he's been behind the team that have established and developed this whole program. So thank you, Alastair. And Alastair's also standing down as our chair of the Ethics and Practice Committee. So another thank you, Alastair, for all the work you've done, and you will be missed. And gone but not forgotten.
Thank you very much, Marcia.
Yeah.
And can I say a huge thank you to everybody who's participated. It's been absolutely amazing. It's been great, and I really appreciate it. And let's stay in touch. And if there are things that we can do and support each other and move forward, fantastic.